If you just ask straight up, do you support Obamacare or the Affordable Care Act, you get a roughly 50-50 split in our country. But as soon as you detail out the various provisions and their specifics, there's some provisions in this law that rise to levels of 70-80% support. And we're going to hopefully detail those out today. Next slide, please. So the one constant that has been true for the last 30 years and will be true for the next several decades is that regardless of whatever action took place in March of 2010, healthcare costs have been skyrocketing. What we've seen is that a family of 4 can expect to spend a very large proportion of their income on health insurance premiums. And so right now, the average premium for a family of 4 is roughly $17,000. That's a big chunk of your income to go towards health care, or at least access to health care. That doesn't even count out-of-pocket costs, drug costs, time missed from work. But what you can appreciate, I hope, is that not having access to health care and having to bear the burden of significantly rising health care costs is an unsustainable pathway for Americans and for our country. So as a result of the Affordable Care Act, the estimates are now projecting that roughly 32 million more Americans will have access, whether it be through the new exchanges that will be set up in 2014. These exchanges will allow private health insurance companies to compete for your business. These exchanges will be regulated such that the insurance products will be fairly uniform. There'll be minimum coverage provisions, things that they will have to provide to you. But it's not that you have to purchase a one-size-fits-all. There are going to be so-called bronze plans, silver plans, gold plans, and platinum plans. The bronze plans probably resembling something like a catastrophic insurance policy, so that if you're in a car accident or if you have cancer, you can get that catastrophic coverage, but maybe it doesn't cover a lot of the bells and whistles that a more generous plan would cover, all the way up to a platinum plan. And so you'll have a range of products and prices that are uniform, so you don't have to decipher the hundreds of pages of fine print that the insurance companies are trying to get you to purchase a product that you don't fully understand. But even more importantly, this bill is going to reform the Medicaid system. The Medicaid system is one that's a federal-state partnership, so every different Medicaid system in all 50 states is different. In Virginia, it's some of the tightest standards to get in. If you're not really, really poor, pregnant, or a child, you're not going to get access to Medicaid. So adults who are not pregnant, obviously, are not going to get access to Medicaid. They're not going to have subsidized health care the way that the Affordable Care Act is going to change that. It's going to be solely based on income from now on, so we level the playing field across 50 states. The reason, I think, and it was, I think, very reasonable, the Heritage Foundation suggested that there be an individual mandate, is because 8 states, 8 in the history of this country, have tried to reform the health insurance market. 8. 7 of them failed. And the 7 that failed, New Jersey being one of them, did not include an individual mandate in their laws. The only state that succeeded is Massachusetts, and they did include an individual mandate. The one who included the mandate, Massachusetts, is succeeding and succeeding wildly. And that's not talked about. It's such a shame because the person who got that law signed is running for president. If there's no individual mandate, the healthiest, the youngest, will likely forego purchasing this care. They will continue to be riders. And it would make the insurance pool sicker. And so health insurance companies, just to survive, will have to charge exorbitant premiums to the sicker patients, and it would just lead to more escalating costs. And there's a lot of speculation that if the Supreme Court strikes down the individual mandate, where the health insurance industry was cooperating in forming the Affordable Care Act, they will now revolt. They will do everything they can to get the entire law stripped away. The Commerce Clause of the U.S. Constitution states that Congress can regulate interstate commerce that has an impact on our overall economy. This is a fifth of our economy. You can't say that there isn't interstate commerce applications because if you live in Southern Virginia, you probably have to see a provider in North Carolina every once in a while. If you live in Northern Virginia, you probably see someone in D.C. or Maryland every once in a while. Yeah. So interstate commerce is something that has always been under the purview of Congress. It's something that should be found constitutional. But the issue is, this is, some will say, the first time the federal government has ever mandated that Americans purchase a private product. It's actually not true. The first president to mandate Americans buy a product was George Washington. And he had the Militia Act, and I believe it wasn't too long after the country was founded, he mandated that everyone keep a musket in the house and at least 20 rounds. There weren't any constitutional challenges at that time.
It's getting more and more.
You'll hear many argue that the healthcare system in America is the best in the world. Having trained at Duke, I can tell you that there's some truth to that. We have the greatest technical care. We have the most advanced technology. We have dedicated nurses and physicians and ancillary health professionals that can provide world-class care. The problem is almost a third of our country can't access it. And so we've always had this notion that cost equals value. Well, if you just are on the most expensive medicine or the most expensive pacemaker or the most expensive this or that, then it must be the best. Well, that's really not true. So cheaper care, better outcomes is possible, and I think that that's where we have to move in this country.